So I asked him if he did any drugs. He looked at me and said no, but I smoke marijuana and do gummies on a daily basis. Story time, guys. So it's 3 a.m. in the ER and it's cold. And if you're in healthcare, you know hospital turns into Alaska at night. So I get up to go get a blanket and all of a sudden I can hear someone all the way at registration vomiting while checking in. We're talking violent retching. I mean, I could hear it all the way over there. He was in his late 20s, maybe early 30s, and smelled like he took a marijuana flavored shower. That was my first clue. He told me that he was experiencing the worst episode of nausea and vomiting he's ever had in his life. And this had lasted for 3 days. He couldn't keep anything down, even water. He had tried everything, including his fiancee's leftover Zofran she took while she was pregnant, but nothing. At this point, there was nothing else to vomit, just bile. Guys, he looked miserable. He was sweating, but no fever. He attributed his symptoms to food poisoning, but told me that his fiancée had the same food, but she never got sick. He had no diarrhea, had not been constipated. He told me that the only thing that seemed to help a little was hot baths. So I asked him if he did any drugs. He looked at me and said no, but I smoke marijuana and do gummies on a daily basis. So after all was said and done, I diagnosed this guy with Cannabinoid Hyperemesis Syndrome, also known as CHS, which is a condition that shows up in long-term frequent cannabis users. We're talking about people who've been using cannabis for weeks to years, which is very paradoxical because cannabis is actually supposed to prevent nausea. But after using it for so long, it eventually triggers it, which creates a challenge when it comes to educating our patients because a lot of them don't believe that marijuana is actually the reason why they're having these symptoms. And these symptoms could get bad. So that patient actually ended up being admitted to the hospital. After checking his blood, I realized that he was severely dehydrated and was actually having acute kidney injury. Some people have this so badly that they lose weight. And I'm not talking about a couple of pounds here and there. I'm talking about a lot of weight. Guys, hot showers help with symptoms, but if you stop smoking that weed, no matter how good the stuff is, your symptoms will usually fade away within days to weeks. Although full recovery may take months sometimes. Dr. Kouandjio, your hero. I love you guys.